back to another edition of the Kellum Connect MD.com Minute. Gabe Farias and Dr. Danny Kellum. It's been a while,
Yes, it has.
but we have a pretty big topic right now, the COVID-19, the coronavirus,
Absolutely.
the novel coronavirus. First off, people hear the word novel coronavirus, and before we even get started, can you kind of touch on why they're calling it the novel coronavirus?
So there's multiple strains of coronavirus, but this is a relatively new one. And I think which speaks to some of the panic and some of the uncertainty of what's going on. Viruses over time change and replicate, and when they do, they create new strains. And this new strain, i.e. the novel coronavirus, now named COVID-19, is really what's been causing this pandemic worldwide and causing a lot of consternation among us here in the U.S.
And the thing that I think of when I think of this type of thing is that no one's ever had it before. That's what's causing the panic. This is not going to be a problem 2 or 3 years from now because people will have it. We'll have vaccines for it. We'll have treatment medications for it. But because it's so new, those things are slow to roll out.
That is very, very true. And I think when you look at the NIH, you look at the CDC, although a few stumbles initially in terms of testing and being able to get that out in a mass scale, I think they've done a very good job, quite frankly, in trying to limit some of the things that we are doing in order to minimize our risk here in the U.S. But over time, I think as people understand whether this will be a seasonal virus, something that comes and go in winter or spring, the ability for us to get a vaccine, which makes all the difference in the world, and then the ability to treat with antivirals, which really mitigates the length of infection, really tends to make a big difference. Although that being said, I will tell you, the thing that we always worry about, despite all of that, is really our risk to seniors and people that have some compromised health. And so we always want to be very diligent about making sure we do the things that we need to do to not only protect ourselves, which is really important, but in situations like this, I think it goes beyond just ourselves. We have to look for our fellow humans to do the things that we need to do to mitigate their risk as well. And so, I think the CDC has laid a lot of guidelines in place to really kind of guide us in that direction, and really for us to make sure that we as a whole do better than us individually. And I think we're doing a good job with that, quite frankly.
Little things like washing your hands, staying out of crowds, making sure you have hand sanitizer on you. Those are the little types of things that can prevent the widespread of this virus.
And that they seem relatively trite, but they're exceptionally important when it comes to this, because the basics of transmission are those things that can be mitigated with those certain practices. Washing your hands for 20 seconds. And when you wash your hands, we typically look at the palms of our hands where we wash, but you want to get in between fingers. You want to get your fingertips, because that's really where we touch. And so we want to make sure we're thorough about what we're doing. Make sure you use an alcohol-based preparation for hand sanitization that contains at least 60% alcohol, because that's really where we make the biggest difference in fighting this. And the creation and practicing of social distancing, it's really important. And so they feel that about 6 feet is the distance that we feel is relatively safe for transmission. And so we want to make sure that we adhere to all of those things. The other thing I will tell you is that when, there's been this big run on cleansers and cleaners and Clorox and all those things, and all very important. But when you're cleaning around, make sure that when you're cleaning your countertops, when you're cleaning certain spaces, allow it to dry for about 4 minutes so that we can make sure that we get some eradication of this viral process. So we don't want to just clean and then use, because we're not necessarily accomplishing the things that we need. But above all, I want to say we need to keep our heads. Although this is serious and this is important, here in San Antonio, we have, as I checked, the last 2, maybe 3 cases of confirmed community spread. So we are doing very, very well within our community. Now, that certainly is an opportunity to change over time, and I think we would be remiss to not recognize that. However, where we're at, things are relatively safe, and so I think we all need to just take a breath, be smart, move through this judiciously, cautiously, purposefully, so that we can really try to mitigate our issues with the community as a whole. And I think that's very important. It's also really important, I think, to really understand perspective. 2010, we had the swine flu outbreak, which we practiced through. And I will tell you, there was no vaccine. there was really no preparation as we are dealing with now in terms of minimizing the spread. And tons of people got sick, and unfortunately there was a ton of fatalities associated with that. We're not seeing that with this particular virus. We have some 2,000 cases in the U.S. I think we've had 52 reported deaths roughly. And so, I think all things considered, the panic and the attention is very heightened, which is appropriate. But the risk and the things that we're seeing have actually been, I'm assuming, better than hoped in some cases. Certainly every fatality is a tragedy, and we always have our prayers for the families that lose people from this particular disease. But I think overall we're doing very well as far as that part of it's concerned.
And there was some mixed messaging coming out of the gate as far as if you're feeling symptomatic, go to your ER. What they're saying though is you're feeling symptomatic, contact your local health care provider. In this case, it's us. And you can do that a couple of ways. Give us a call, 210-945-2121, which is the number to Kellum Family Medicine. And our schedulers and our medical professionals, they've got the criteria that can be able to tell you, you are a risk. You need to come in right away. We will test you. We do have a few tests at Kellum. Or if you want to, telemedicine is getting big right now.
Yeah.
If you feel symptomatic, KellumConnectMD.com is a way to check out and see if at the very minimum you can talk to somebody without going into a waiting room.
And that is actually a wonderful point. And I will tell you, from Kellum Connect MD, we've been working very hard, as y'all know, over the last several years to really try to push forward the idea of telemedicine. And this particular instance, I think, heightens the beauty of what we've been trying to do. And so what I would say is if you have questions, if you have concerns, if you have colds, coughs, because one of the things here in San Antonio that we got to remember is that we are now entering into the pollen season, which brings on a ton of respiratory issues as well. And so that is going to be an impetus for panic for a lot of people. And so as opposed to going into the office, what I would say is use Kellum Connect MD. Super simple. You can do it from anywhere. You don't necessarily have to be worried about entering into crowds in a doctor's office. And we can certainly evaluate issues, understand risk for the disease, and then guide you in the place that we need to go to see. Testing is not necessarily as widespread as we need to. However, I think within the next couple of weeks, it will be within what we term point of care. So in the doctor's offices, you can get something done and get a relatively rapid response in terms of the outcomes. For now, there are collection places that can go. They send the tests out. They get them back within a day or two, and then we can understand what's going on. What's really important, I think, is that we're seeing less of an issue amongst the younger population. And I don't necessarily know, at least I have not read why that is, but there seems to be some inherent immunity to that. What we know in terms of the population up to about 60, they do very well with minimal to no symptoms. It's a cold in most cases that get better now. I don't want to underestimate the risk with that, because some of those people certainly can get sicker to see. And then over the age of 60 and certainly over the age of 80, which is the average age of fatality in these cases, those are the individuals that we really want to be mindful of. And what's really important is don't get symptoms and be scared. If you get symptoms, call and let us engage, because sometimes it's the pneumonias, it's the things that come associated with that are really the causes of fatality in a lot of individuals. And supportive care is a very important part of what we need to do. The preparatory things that we can do, from hand washing and social distancing and all of those things, really do help mitigate risk of spread. However, we still can treat. We can still get people feeling better. We can still provide supportive care. And so this is not something we're powerless. This is certainly not something that we don't know how to make better. We just don't have specific things in place right now that can actually work on the viral part of it itself or prevent it from a vaccine. But this is the greatest country in the world when it comes to healthcare, and I think we can do many, many, many things to help people get better despite a serious condition in that case. Doesn't happen always, but I think we can do a wonderful job in making it better. So do not fear going to the doctor. And if you do, KellumConnectMD.com is a wonderful way of trying to at least get in front of us. We will take the time to speak with you, to understand what your symptoms are, and to give you, to the best of our ability, the knowledge and understanding and hopefully comfort that you need to guide through this difficult time. Because right now, there is a lot of panic, some misinformation, and just a lot of worry and fear in terms of what we're doing. And so what I would say is listen to our government. In this case, I think they're doing a fantastic job. The heads of the NIH apolitical organizations are doing all they can to really keep us safe, which is really very important. And we all have to work together to make sure that we do what's best for the betterment of the community. This is one of those times that our community and our country is bigger than ourselves, and we have to really make sure we're doing the things we need to do to fight and mitigate this issue so that we can get ahead of it.
And folks, we're posting on our Facebook page, Kellum Family Medicine, the Kellum Family Medicine Facebook page. We're constantly posting information on what to do, what not to do, and how to really help be a part of the solution to what is happening right now with the coronavirus and COVID-19. Remember, KellumConnectMD.com. If you don't want to go into the waiting room, visit KellumConnectMD.com. You can see a medical professional to even talk about some of the symptoms that you have. Or if you just don't want to come in and you have an issue, an acute illness, some sort of issue you want to, you need addressing of or work on, KellumConnectMD.com. Dr. Kellum?
Gabe, may I just take a second to say before we go? I think this is one of those important times. Is Kellum Connect MD certainly is very, very important in terms of the acute issues that come on. But what I will say as the developer of Kellum Connect MD is that we want to use this time to help calm fears. And so if you're not having an issue but you have questions, get on Kellum Connect MD. It does not bother us. We love to teach. We love to reassure. That is what we do as doctors. And if you feel like you have questions or something is concerning, please utilize Kellum Connect MD. It does not aggravate us. We love to help. We love to teach. And more importantly, at the end of it all, if we could provide you and your family some peace of mind in terms of this pandemic, then I think we're doing our jobs as doctors. And so please, in this case, not only if you're sick, but if you're questioning it, utilize us. We'd be glad to spend time informing, teaching, reassuring, and helping you guide through this with you and your family to keep them safe. Because most importantly, that's what we're here to do.
All right, Dr. Kellum, thank you so very much. For Dr. Danny Kellum, I'm Gabe Farias, and stay safe.
Stay safe.